So we have a sick goat. She's either got listeria or she's got goat polio. So the first thing we're going to do is give a dose of penicillin in case it's the listeria. This is B complex. And again, this is to help with the issue if it's polio. And the reason that we treat for both, because it's really hard to determine. Their symptoms are so much the same that it's hard to distinguish which is which. And lastly is Banamine, which is like an NSAID, or it's like a ibuprofen. So the first thing we're going to do is give a dose of penicillin. We'll give it IM. And this is the treatment that my vet has, and my vet and myself have talked about. So we're giving an antibiotic in case it's the listeria, which is a bacterial infection from, just comes out of the dirt in the ground. Then we'll give a vitamin B complex, which will help with the thiamine issue if it is the goat polio. And we'll also give a dose of Banamine, which is an anti-inflammatory, to help reduce some of the inflammation that could be on the brain, which is causing kind of the neurological symptoms. And the reason we know this is she's blind, right? She's not moving, so she's blind. Usually they kind of turn their head up and do what's called stargazing. Hopefully we've caught her quick enough that we can help with this. If you get them quick, you usually can reverse it, but it's rapid treatment of IV, thiamine, and then the anti-inflammatories help with pain that they're having and help reduce inflammation in the spinal column and the brain. I don't know if you could hear that. Occasionally she's gritting her teeth, and that's usually a sign of pain in a goat as well. So what we'll do is we'll give her an IM injection of antibiotic, and I'll put a link in up here that shows you where and how to give that. So she's not going to like that. I'm sure it burns and stings like when we get an antibiotic. So that shot, we'll turn her back loose. This is B complex. And again, this is to help with the issue if it's polio. And the reason that we treat for both, because it's really hard to determine. Their symptoms are so much the same that it's hard to distinguish which is which. And so if you just treat from one, there's a good chance they could die from the other. So let's turn her. Here, baby, I'm sorry. Let's turn you around and give you a shot on the other side. And I know you're wondering what kind of pen we're in. This is just a little dog pen that we have in the back. We have it insulated for the winter time if we have somebody that gets cold, and we use it for kind of a medical pen too, especially for something little. Again, IM injection. All right, there's that one. That's the B complex, the antibiotic, and lastly is Banamine, which is like an NSAID, or for the medical people, or it's like a kind of like a IV IM shot version of ibuprofen. Thank you. I couldn't get my words out. Sarah's back there helping me. And again, I'm not going to go over doses with you, because that's not my job to do that. It's your job for you and your vet to figure it out. But I'm just telling you that is the course of treatment that we use, my vet uses. Got this in our little cooler bag. The penicillin and the B complex needs to be kept cold. The Banamine can be kept just in normal temperatures. We're giving her some greenery. We'll put some hay in here. We probably will not put like pelleted feed right now, because sometimes that can be a cause of the goat polio. So the greenery's really good. It helps settle the room and it helps feed the microbes, and the microbes are what creates the thiamine, and the thiamine is what's wrong if it's the polio. So you can tell she's really in good shape. She's nice and slick, good size and weight. So hopefully we can get her straightened out. I can tell you why I brought her in. If you leave them in the pasture and you treat them and then they start to get better, you need to treat them for a couple of days even after they get to feeling better. And if they get better, then they're hard to catch and you can't treat, and then they kind of go downhill again. Ask me how I know that, because I've done it. So we hope those medicines will work, and I'll treat her again soon. I think it's every 12 hours, but I'll check with my vet. I've got a good relationship. I'll shoot her a text. She's a mobile large animal vet. She really helps me a lot on the farm, Dr. Karen. All right. So you guys can see she's actually following my hand. She is moving now away from me. She sees me. She sees movement. She may not be 100% back to that movement, or her vision may not be 100% back, but she's at least seeing. She don't want me to touch her. She's seeing shapes and movements, so that is a positive. The quick recovery of that is probably due to the thiamine deficiency. I'm going to say this was a polio case instead of a listeria case, but we're still treating for both. Not 100% sure that she's going to, recover, make it. We've given her some foliage to continue to feed on. She's got nice, clean, fresh water here. Covered up place. She's got a good ventilation. So we're extremely happy with the way things are going, that she is actually making an improvement instead of decreasing or going backwards in her sickness. Right, so it's about 8:45, 9 o'clock on Monday. I think it's Monday. And we're treating the goat again every 12 hours like we said so. She's actually doing a lot better. Her vision has come back some, or her vision has come back. She definitely does not want to be messed with, so that's a positive. The vet says we need to keep her for probably 5 days and treat her. So we'll probably keep her 2 to 3 days, which will give us about 5 days. We need to keep treating her so that we don't relapse back into where we were at. So we're back down here with the doe that we've been treating for a few days. We went and got a roll. We went and got a square bale of hay for her. We've been giving her just maple, poplar, pine, which seems to be soothing to the stomach, and talking to our vet and reading some information. That's usually good. But now we went and got a bale of hay to go along with that, and we won't give her any grain until we get the We don't really want to give any grain until we get her over this, because sometimes the actual grain in the ruminant is the problem that causes the goat polio, if that's what it might be. I'm going to go up and get her injections, and we'll come back and give her 2 injections this morning for her 12 hours. You can tell she's actually seeing us now. She don't want to be messed with, so that's a good improvement. And she hates us doing it, but we're going to catch her, give her 2 shots, and then leave her alone, and hopefully she'll start eating some of the hay, and that'll help her ruminant go ahead and produce some of her own thiamine to help things get better as well. Come here, girl. It's okay. Come here. I know. You're a lot better. Well, so she knocked you guys over. I just got to grab her. Come here. Come here. Now I'll set the camera back up. She knocked you over again. So she is feisty, and obviously feeling better, and I know she doesn't want another injection, but I'm sorry, baby. I know. Almost done. Oh, you're stronger than you were. That's a good thing. Okay. All right, I'm gonna leave you alone. She wants us out of here. She's tired of getting poked. This is day 3. 2 more days and we should be good. But I am really, really happy that she is, you know, eating some hay. That's what we want to see. She got her appetite back. She can see. She's drinking a little water. So, yeah. I really think we caught this very quickly, and I think that we're going to see her make a full recovery. So in about 2 more days, 2.5 more days, we'll be able to put her back with the herd. And that'll be the most helpful thing of all. They do not like to be alone. All right, guys, day 7. And this is a little goat we've been treating in a little cage or a little holding pen at home. That's her brother with her there. He is a wether, so we're growing him out for food or meat. But that little girl is doing wonderful. She's doing amazing, looking good. She's been out in the pasture, been foraging, eating just like the rest of them. So we're gonna call that a win for sure. You can tell she sees well. She's pretty quick on her feet. She don't want to be messed with, so we're all good.